The organization has warned that the COVID-19 pandemic is threatening to reverse progress made in eliminating tuberculosis. The global health body launched its 2020 Tuberculosis Report today. It says that TB cases of the world's deadliest infectious disease are likely to rise without urgent action and investment. The report says that tuberculosis killed some 1.4 million people in 2019. That's little change from 1.5 million deaths that it caused in 2018. The WHO has warned that many countries are not on track to meet targets for successfully diagnosing and treating cases to try and stop the disease's spread. It says that disruptions in services caused by the COVID-19 pandemic have led to major setbacks to TB programs. Well, for more on this, I'm now joined via Zoom by the Director of the World Health Organization's Global TB Program, Dr. Tereza Kasaeva. Thanks so much indeed for joining us and welcome to the program.
Thank you very much for invitations. Greetings from Geneva, dear colleagues.
All right, so let's talk about this global TB report that you've just released. What would you say are the main points that have come through this year?
Yes, unfortunately, you are absolutely right. TB remains the biggest infectious disease killer in the world, claiming close to 4,000 lives a day. It is also the leading cause of death of people living with HIV and a major contributor into the death related to antimicrobial resistance. 10 million people fell ill annually due to TB, and unfortunately this situation remains stable from year to year. And among these 10 million, around 5.6 million are men, 3.2 million women, and 1.2 million children. Among all those affected, 8.2% were people living with HIV. But I would like to remind you all that TB is a preventable, treatable, and curable disease, but it's remaining the biggest problems, a so-called old disease, which exists for centuries, and we are trying to combat it unsuccessfully for many years. But to be honest, we should say that around 60 million lives were saved since 2000. If we are looking at the progress in compare with the 2015, number of incidents reduced by 9%, and the number of TB deaths dropped by 14%. But it's not enough at all. According to our NTB strategy targets and commitments, 2020 is a year of our milestone targets, and the reduction should be much more. It should be at least 20% in TB incidence and at least 35% in the death. But also there are some positive news and good examples from the countries and regions. At least one region, European region, is on track, and also very good progress is demonstrating African region, despite of being one of the most affected by TB and HIV. So it really shows us that this disease can be combated. Unfortunately, currently we are all facing a new threat, new disease, COVID-19. And this disease affects all the people worldwide, but in the same time, it causes significant impact, negative impact onto the continuation of the TB services. And what we can see worldwide is a massive disruption of the essential TB services.
Sorry, Doctor, explain to us how progress in combating TB has been disrupted by COVID-19. What specifically has happened?
Yes, I've just started that COVID impacted indeed all health services, but
Right.
in terms of TB, this disruption is really significant, and we would like, World Health Assembly would like to alert that currently we can see the massive drop in the notification of TB. It's around 25 up to 50% in the high TB burden countries. And if this disruption will continue more than 3 months, it will lead to a significant increase in TB death and incidence already this year. And TB death can increase up to 400,000 more deaths, and it will be really very threatening, and we should try to do our best and to avoid it.
All right, so what actually is going wrong? Is it that people are not going for treatment because they're scared of catching COVID-19? Is it that the health systems are inundated dealing with COVID-19, that they don't have the capacity to deal with TB patients? Or is it a combination of all of that?
Actually, you are right. It's combination, and the problem is very complex. It's due to lockdown, to the restriction measures in the countries, and also due to fear and stigma. Frequently, health services are not accessible. They're closed because they can't provide necessary infection control measures. We can see also shortage of the drugs and many other reasons. It's a complex problem, and of course, it should be addressed with a comprehensive approach.
Funding is always a critical issue, and I think the report starts by talking about the need for investment. I know at this stage that you're only getting half of what you need. How can the gap be closed, and what would it mean if you were able to get all the funds that you require?
Again, you're absolutely right. We were so inspired, all TB community in 2018 during first ever UN General Assembly high-level meeting on TB, when we've received very strong commitments and targets, a significantly increased funding of the TB programs and TB services. And our target is at least 13 billion annually up to 2022 should be provided. This is a global target. But based on our report, we can see that we're hardly receiving half of this funding. $6.5 billion globally were invested in TB programs. It's not sufficient at all with these ambitious targets to end TB by 2030, and also taking into consideration current situation with COVID. In the same time, we can see that if there is a strong commitment and will and involvement in the problem, these funds can be raised, and we are learning the lessons of the current situations. And of course, we need more investment from the side of the funders, donors, and manufacturers in solving TB, as well as increased financing from the domestic sources, though we understand that it's becoming challenging.
All right, we believe that 90% of all the people that fall sick with TB are in just 30 countries in the world. What does that tell us about our ability to get rid of this disease completely?
Yes, we have category of countries, so-called highest TB burden country, and a total there are 48, and the disease is concentrating mostly in 30 countries. Indeed, they're mostly low and middle income countries, and the situation, the burden is huge due to numerous reasons. And if we we will highlight just the most important of them. It's, of course, first of all, TB is disease of poverty. It's heavily depending on socio-economic factors. And the poorest, malnourished population, the most marginalized, are at most risk of development of TB. And of course, it needs much more attention from the developing world, from those who are making the decisions at different levels, because this curable disease cannot continue forever. We are living in the 21st century with amazing advantages in science and technologies, but still people had to suffer and had to go through the very painful and long treatment, even if it's accessible for patients with especially it's difficult for the patients with the drug-resistant tuberculosis. So that's why political will, high-level commitments, plus investments, plus massive investment from the sides of the international donors are urgently required.
All right, and on that note, that's where we'll leave it. Thanks very much indeed for giving us your time this evening and sharing that important message. And let's hope that the authorities that need to hear this message respond and help you with your work. Thank you so much.
Thank you very much. Thank you very much for your attention.